Thank you so much for having me today. My name is Dr. Jenna Tosto Mancuso, and I am a physical therapist and the clinical director of the Abilities Research Center here at Mount Sinai. And today we are going to be discussing post stroke rehabilitation to learn a little bit more about the road to recovery after a stroke. So, what are the post-stroke symptoms? What for an individual who has had a stroke? What are some of the moderate or severe symptoms? So, after an individual has a stroke, the symptoms that present are largely dependent on where in the brain the stroke occurred. And so, some symptoms that an individual might experience after a moderate or severe stroke include things like weakness on one side of the body, both on the body itself as well as of the face, visual changes and visual disturbances, changes in speech and language, both in our ability to talk, but also in our ability to understand, changes in consciousness and awakeness, difficulty in coordinating movement and movement in general. And all of these symptoms, as they present, result in a change in our functional ability or our ability to participate in our day to day life. So, why do these issues happen? Well, when we think about strokes, it's important to differentiate that there are two different types of strokes primarily. One, an ischemic stroke, is a stroke that results from a change in blood flow in a blood vessel in the brain. Now, that change in blood flow or blockage of blood flow can be the result of a blood clot or the blood vessel narrowing. The other type of stroke that we see is called a hemorrhagic stroke. And a hemorrhagic stroke results when a blood vessel in the brain begins to bleed. Now, the blood vessel in the brain can begin to bleed either from uncontrolled high blood pressure, from the rupture of a weakened portion or bulging portion of the blood vessel called an aneurysm, or from weakness of the blood vessel in general. So, can we completely lose or regain function? So, I think it's very important for us to distinguish that every individual is different. So, it's very hard to speak in an all or none fashion. But what we can say is that both research and clinical evidence tell us that our ability to regain function after a stroke is indeed possible. So, many of the factors that contribute to our ability to regain function after a stroke are largely dependent on the time of treatment, the type of treatment we receive from a medical intervention, and then the type of rehabilitation that an individual undergoes. And so we know that our ability to regain function is dependent on the brain's ability to change. So the brain is pretty amazing. It has a capacity called neuroplasticity, which is the ability to change, to strengthen connections, to reconnect and form connections that are newer. To compensate for areas of the brain that may have been damaged during the stroke. And so when we think about rehabilitation and our goal of regaining function, really what we want to be focusing on are interventions that are high intensity, highly repetitious, that are meaningful to us and for our patients, and that allow us to start to think about restoration and recovery of that neurological system. So, what do you do to regain function? So, like I had just said, there are a few really key factors that help to drive that neuroplastic capacity. So, the idea that our intervention should be specific to what we want to work on, that they should be intense in nature, meaning that practice makes perfect, really comes into play here. When we think about rehabilitation after a stroke, there are many members of our rehabilitation team that are pivotal to help patients regain function. From the medical standpoint, a physiatrist or a rehabilitation doctor may be leading the medical recovery. From a rehabilitation specialist standpoint, physical therapists, occupational therapists, speech language therapists, all of those individual specialists can help our patients and work with our patients to create specialized programs that are specific to those needs. And so, in our quest to regain function, being specialized and thinking along patient specificity, what does each individual patient need in their road to recovery, really makes the biggest difference in our ability to regain function. Additionally, the interventions that we provide or the rehabilitation exercises and activities that we partake in really are pivotal to help us regain function. And so, with the advent of new technology and new innovations, everything from robotics and exoskeletons to implantable devices that help to prime that central nervous system or prime the brain for recovery. All of those components together allow us to really expedite and to promote our ability to regain function. So, what happens during a stroke, and what should you do if you think you or someone you know is having a stroke? Like we discussed earlier, what happens during a stroke can be related to either, again, that ischemic or hemorrhagic event. So, there's some type of injury or pathology to the blood vessels of the brain that change blood flow or limit blood flow to a particular area of the brain. And so, if you think you or someone you know is having a stroke, there is an acronym to remember to help make sure that you are recognizing those signs and symptoms and acting as quickly as you can. And so the acronym to remember is B FAST, BEFAST. And I'm going to go through it with you just so that we cover those bases and hopefully that acronym sticks. So the B in B FAST stands for balance. Any change in balance, coordination, walking, have any of those things changed? Ask yourself. E stands for eyes. Is there any change in vision, visual disturbances, blurry vision, spots or flecks as you're looking and really using your eyes? F, facial droop. Is each side of the face symmetrical? Do we notice that there is a change or a drooping of an eye, of the lower portion of the mouth? Do we still have wrinkles around the face in those areas that we typically do? Oftentimes, if an individual is experiencing a stroke, we see that one side of the face begins to droop. So we've covered BEFA, arms. Are you able to lift your arms symmetrically? Does one arm appear to be dropping or drooping lower? A stands for arms. So we have BEFAS. S stands for speech. Are you having difficulty speaking? Is speech slurred? Are you having trouble understanding what's being said to you? Those could all be signs of a stroke. So we've got BEFAST. T is, I can argue, one of the most pivotal things for us to know is timing. Timing is absolutely everything when it comes to acknowledging and getting care for a stroke. If you or someone you know thinks they may be having a stroke, acting quickly, getting to your nearest emergency department really is the key. There are life saving interventions that the medical teams can provide at the hospital, and many of them are time dependent. And what we also know is that the quicker we act, if we think there is a stroke event happening, and there is in fact a stroke event happening, the sooner that we act, the lower risk for high functional loss there is. So we can really start to help preserve the brain and protect the brain if we act in a timely fashion. So again, always remember the fast, key to timing, and remembering what those letters stand for is really important if you or someone you know thinks they may be having a stroke.